Josh, I just wanted to catch up with you because tomorrow is a big day. We're heading into general eligibility here for vaccines in Connecticut. Give us some tips, some advice. What do people need to know as we head into this phase of everyone being eligible?
Yes, well, it's definitely an exciting day tomorrow. All 16 and above residents in the state eligible. As the governor said, every time we start a new phase, there are a lot more people looking to book appointments than we have doses coming into the state that week. So as always, a little bit of patience tomorrow will be needed for people who are eager to sign up. The good news is we do have 240,000 first doses allocated to the state this week, which is an all-time high. So there will be a lot of appointments, but not enough for everybody that we estimate will be interested. But hang in there, be patient. We add new appointments every day in many of our providers. And most importantly, based on the supply of vaccine that we're anticipating over the next several weeks, we're very confident that everybody who wants to get a vaccine will have the opportunity to get one during the month of April.
Do you happen to know roughly what we're projecting as far as first doses out for the next couple of weeks?
Well, the White House has been pretty good about setting expectations and then ticking up a little bit each week. So, we're hopeful that we'll be seeing over 200,000 doses per week throughout the month. Next week, we're anticipating getting a lot of additional Johnson & Johnson vaccine, which is great. We know a lot of people really like that. They like the fact that it's just one shot. So that's good news. The supply chain is really ramping up for J&J. So we don't get perfect visibility, but all indications are that we're going to continue to see a lot of vaccine coming into the state every week.
And Josh, even with this new phase, I'm told that the state plans to allocate now 31% of our vaccine supply to socially vulnerable communities. But even as more people are getting this vaccine, we're still seeing that disparity in vaccine equity. What's the state doing to address this?
Yes, it is an area of tremendous focus for the state, all of our local partners and our providers right now. You're absolutely right. We're not seeing vaccination rates at the same levels in many of our cities among minority populations. So the governor's announced a number of investments that we are putting out there to help support providers and local partners to do more direct outreach, to go door to door, to do calling to people, to provide transportation, to do pop-up clinics in street corners, people's neighborhoods, at their churches. We're going to have a fleet of 35 mobile vans crisscrossing, our under-vaccinated neighborhoods to, stop for a morning, right, at one location and vaccinate 80 people, walk up, and then on to the next one. And putting more money in our local health departments too, who've already been doing a lot of this work for months now, but giving them more financial resources to be able to do even more and bring on more help. So this is something we're going to be talking about a lot for the next couple of months, but we are optimistic that we're going to make it as easy as possible for everybody to get vaccine.
Josh, as you mentioned, every day we're seeing more and more people get vaccinated, but we are also seeing the infection rate creep up along with hospitalizations. So how do you reconcile those two things, that more people are getting vaccinated, but we're seeing these concerning data trends, and sort of what do you think is driving that?
Sure. Well, we're seeing in the Northeast region right now, an increase in cases and hospitalizations. So when you look today at the list of the top 10 states with the most cases per capita over the last week, 9 out of the 10 are the Northeast, everyone from Delaware to New Hampshire and everyone in between. So there's some, seasonality involved here clearly, but nonetheless, it is resulted in a bit of an increase in cases and hospitalizations in Connecticut, particularly among people who are younger, people in their 20s and 30s. We're seeing more cases right now. It's an important reminder for everybody, even if you're young, the odds of you getting sick or certainly from dying are very, very low. But when you have large numbers of cases in community transmission, young people are ending up in the hospital right now, seriously ill, and it can happen, and people need to remember that. The great news, though, is that we are not seeing those increases in the older populations, the populations that the governor prioritized for vaccination early on that age-based rollout. We've now got over 80% of our seniors 65 and above vaccinated. We've got 2/3 of everybody 55 and above in the entire state now with their first vaccine. You get significant protection off that first dose. So that really makes a difference to get that started. We want to get the second dose as well. but that's a big deal. And when you look at our death rates as a result, they're actually continuing to go down. And although we're in the top 10 in the nation in most cases per capita, we're number 37 in the nation right now in deaths per capita over the last week. So that strategy's really worked well, but we need to keep our guard up a little bit longer here until we can get through this next phase of vaccination, because these vaccines work so well, but we still have some time to go before everybody's got one.
Yeah, and Connecticut is fourth, by the way, in new COVID cases in the country per capita. Some people would say we reopened too quickly. Some people say we didn't reopen quickly enough. Are we doing anything wrong considering that we're fourth in the number of new COVID cases?
Yeah, well, as I mentioned, the others in the top, number one is New York. I think number three is New Jersey. They're actually significantly higher than us, and they have, in most cases, more restrictions in place than we do currently. So it's hard to draw a straight line from restrictions to case rates, even amongst our neighboring states who've had a pretty similar experience to Connecticut in terms of that first wave and the degree of mask wearing that we have in our states and the rules that we've put in place over the last year. So clearly there's some seasonality involved in this, but regardless of what the cause is, we need everyone to keep wearing their masks, stay away from large groups, try not to travel around spring break. That's an important piece of advice from the CDC and our Department of Public Health. But we're optimistic we'll get through this as we get more people vaccinated.
All right, I'm hoping you could shed a little light on this. I'm told that there is a statewide plan in the works that would help boost our surveillance capacity when it comes to these COVID variants and what we're doing on genomic sequencing. Can you tell us a little bit about that?
Yeah, well, we've been very fortunate to this point to have great partners in the state, the Yale School of Public Health, Yale School of Medicine, as well as Jackson Labs, who have been doing sequencing of a lot of the positive COVID test results to look for these variants. But with support from the federal government, we, like all states, are looking to scale up additional partners to do genomic sequencing looking for variants. And we're in the process right now of getting those partners in place. And the goal is to be sequencing about 10% of the positive cases that occur to get increased visibility into what variants are circulating in the population.
10% from different geographical areas of the state, I'm assuming?
Correct.
Josh, and lastly for you, Dr. Fauci said that it may take until 2022 for COVID vaccines to be authorized for kids. We did get some good news, as you may know, from Pfizer today in a phase 3 trial of adolescents that showed 100% efficacy for the vaccine there. But I guess the question is, do you think that we have even a shot at ending this pandemic before 2022 if we're not going to be able to get kids vaccinated?
Listen, what's been incredible about this vaccine development program is that every step of the way, the scientists have kind of overachieved what were kind of expectations around how long things would take. And so, I think we can all remain optimistic that will continue. As you said, the good news this morning about the age 12 to 15 trial results. We know there's, enrolled clinical trials all the way down to 6-month-olds. But look, no one really knows the answer of, how many people need to get vaccinated to get to the herd immunity. So we'll see. I mean, our goal is just to get as many people vaccinated as quickly as we can and hope that we, have a similar experience this spring and summer as we did last spring and summer, even when we had no one vaccinated, where we were able to, really get those case rates down very, very low. And at this summer, we should have very high percentage of our population vaccinated in addition with vaccines that work incredibly well. So, we're hopeful that we can, get back to normal sooner.